I need some advice on what I should do in my situation. I have a bad tooth and back that has gotten worse lately. It's painful to chew on, and I had one day where I experienced a lot of pain with it, especially with exposure to cold. Now it's more of a dull ache, and I'm not noticing the cold issue. I probably need a root canal. They told me ages ago this tooth was cracked, but it hasn't become a problem until recently. I would go to my endodontist, but here's the main problem. I'm immune compromised, and ending up with coronavirus would be very dangerous for me. I won't be able to receive my vaccine for several weeks, and I don't want to sit in a dentist chair because I believe it could potentially expose me to the virus. My MD put me on Augmentin for 10 days, and I'm 7 days in. The pain is bearable, but not fun. I just want to make sure that I'm not doing anything dangerous by waiting. I've read about how ignoring ongoing tooth pain like this could be a dangerous thing to do. How do I weigh the potential risk of the endodontist versus waiting to get the vaccine?
The dentist can help. Just a couple quick questions before I transfer you. Is the pain constant, or does it come and go?
It comes and goes. I use a mouth guard at night, and usually wake up pain-free.
Have you experienced any side effects from Augmentin?
No, but I only have a few days of it left.
Anything else in your medical history you think the dentist should know?
High blood pressure, diabetes, and fatty liver disease.
How do you weigh the relative risks of venturing out to a dentist versus gambling on your infection becoming serious? That's an impossible task, first because the presentation of the SARS-CoV-2 depends on issues that can't be known, the particular strain you encounter, the type and severity of your immune compromise, and the calculus of your exposure on your trip from your home to your dentist and back again. There are several issues to consider. While antibiotics like amoxicillin/clavulanate, Augmentin, can help to suppress dental infection temporarily, they can't eliminate it. That means that your risk of acute infection will resume at the end of your course of antibiotic therapy. And as someone with immune system impairment, you're more likely to experience emergence of opportunistic infection, candidiasis, Clostridium difficile, from a course of antibiotic, so prolonged administration of antibiotic is ill-advised. This may seem paradoxical, but because many of the more severe symptoms of COVID-19 are due to a vigorous immune response, your immune system impairment may actually diminish your risk of severe COVID. Just remember that you must weigh the risk of problems you have now, dental infection, against the risk of possible future risk. Your dentists are legally obligated to practice effective infection control protocols, so your risk is relatively low there. Public health measures are well known, and adherence to them, social distancing, mask wearing, hand washing, avoiding touching the face, are effective deterrents to infection transmission. On balance, the choice is clear: you have an infection now. The resolution of cold sensitivity makes this a certainty, so the preferred route is to arrange a meeting with your dentist. If you are concerned, you can call ahead and ask your dentist, in light of your immune suppression, to schedule you at a time when other patients are not in attendance. Good luck!
My endo has a large practice with several patient rooms, with outdoors, within a larger office building. So I don't want to go there unless absolutely necessary. There is general dentist in town, with one chair. If I go to the small dental practice, do you believe there is something he could do to kick the can down the road, and put off having oral surgery now? Or would going to him just involve a referral to an endo anyway? I realize you don't know any of the people, and haven't examined me, but I'm just looking for guidance on if you feel going to the small practice is worthwhile.
Not only do I not know those people, but given the amount of time you've already delayed attending to this tooth, it's uncertain whether endodontics is the appropriate approach. Most dental problems present a limited window of opportunity for treating in a way that can salvage a tooth. It may well be that the more appropriate thing is to remove the tooth rather than perform a root canal. And often the deciding factors that determine whether a tooth can be salvaged deal with its structural integrity, something that is, strictly speaking, outside the scope of practice of an endodontist. I have seen multiple cases of teeth that have received root canal at an endodontist that were subsequently determined to be non-restorable. I believe your best first option is to arrange to see a general dentist, preferably one who would be responsible for restoring the tooth prior to seeing an endodontist. This would serve to lower the number of unnecessary diagnostic visits, and thereby lower your environmental exposure to COVID. Good luck!
If you have a health question and want to chat with a doctor now, visit justanswer.com/ythealth.